Meet April. Like you, she's a third-year nursing student at Ryerson University who is doing her clinical placement at Sunnybrook Hospital. She's recently begun to see an increase in catheter-associated urinary tract infections on her unit. In Canada, CODIs account for nearly one-third of nosocomial infections, and they contribute to extended hospital stays, higher expenses, and increased mortality rates. Hearing these alarming statistics, April shares this issue with her clinical team members, Sameen, Saher, Olivia, Telford, Gwyneth, Camille, and Caitlin, to get to the root of this problem. Digging deeper into the issue, the team finds statistics showing that 21 to 54% of indwelling urinary catheters lack evidence-based reason for their continuation, demonstrating inadequate knowledge of appropriate IUC indicators amongst healthcare professionals. In fact, the most significant predisposition to CODIs is prolonged IUC usage. Based on this information, April's team aims to reduce the duration of IUC usage amongst Toronto inpatient units by educating registered nurses on making clinical judgments related to the appropriateness of catheterization and by promoting evidence-based approaches to catheter management. Understanding the effectiveness that infographics have on knowledge dissemination, the team plans to develop one with a flowchart that RNs working in Toronto inpatient units can refer to throughout their practice. The infographic is an evidence-based resource to determine whether IUC use is appropriate for their patients by introducing the alternatives, appropriate indications, and methods for decreasing the duration of use. It also outlines common complications of IUC use and the corresponding nursing interventions. The infographic can be generalized to all inpatient units in Toronto as it is based on RNAO guidelines. To pilot this intervention, the infographic will be distributed to the clinical nurse educators on the units where April's team members work and will be presented during nursing huddles.
In implementing their change initiative and achieving their goal, April and her colleagues decide to use the 5 principles of the learning organization theory. The first principle is personal mastery. April's team decides to highlight the correlation between high inpatient CODI rates and prolonged IUC usage in their infographic by drawing on statistics and prevalence rates to promote the need for change amongst RNs. To incorporate the second principle, mental models, April and her colleagues identify common misconceptions about IUC usage through a literature review to inform the design of their infographic. They examine articles from the PubMed, Medline, and CINAHL databases. For the principle of team learning, April's team decides to implement team huddles scheduled before and during every shift to share information and values regarding IUCs. Along with their infographic, they promote the development of mutual mental models among staff. The implementation of these structured huddles also integrates the fourth principle, shared vision. With these team huddles, April and her colleagues remind RNs about the appropriateness of IUCs, thus sustaining shared vision among nursing teams. Finally, April's team plans to demonstrate systems thinking through the development and implementation of their infographic, which will holistically embody the other 4 principles. Furthermore, their preliminary literature review helped to identify existing systemic barriers to CODI reduction, allowing them to consider these factors during the implementation of their infographic. To evaluate the effectiveness of their intervention, April's team will measure the incidence rates of CODIs plus the number of catheter days, 1 month prior to the intervention and again 1 month after initial implementation, a quasi-experimental pre- and post-intervention design. Inpatient units that choose to not adopt the infographic will be designated the control group of that organization. Data is to be collected through publicly shared hospital audits and Infection Prevention and Control, or IPAC reports. A net reduction in CODIs and days of catheterization compared to the control groups will let April and her team know that their efforts for change were successful. To summarize, by identifying gaps in clinical knowledge through a literature review, April's team was able to respond with an infographic designed to refine the clinical judgment of RNs in relation to IUC appropriateness and timely removal. We wish them luck on their endeavor to reduce the CODI rates on their unit following this approach.